Oxaprozin is a medication used to treat arthritis. It helps to reduce pain, swelling, and stiffness in the joints. Oxaprozin belongs to a group of medications called nonsteroidal anti-inflammatory drugs, NSAIDs. It's important to note that if you are dealing with a chronic condition like arthritis, it's a good idea to talk to your doctor about non-drug treatments or using other medications to help manage your pain. It's also important to discuss any concerns with your doctor before starting this medication. As always, be sure to follow your doctor's instructions for the proper dosage and timing of taking oxaprozin. Before taking oxaprozin, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. It's best to drink a full glass of water with it, unless your doctor tells you otherwise. Avoid lying down for at least 10 minutes after taking this drug. If you experience stomach upset, try taking it with food, milk, or an antacid. The dosage of oxaprozin is based on your medical condition, body weight, and how you respond to the treatment. It's important to use the lowest effective dose for the shortest possible length of time to minimize the risk of side effects, such as stomach bleeding. Don't increase your dose or take this drug more often than directed by your doctor. For chronic conditions like arthritis, continue taking it as directed by your doctor. It may take up to 2 weeks of regular use before you notice the full benefits, especially for conditions like arthritis. Discuss the risks and benefits of oxaprozin with your doctor or pharmacist. It's also important to let your doctor know if your condition worsens. And remember, if oxaprozin comes in different forms, such as tablets or capsules, don't switch between them without consulting your doctor. Some common side effects of oxaprozin may include upset stomach, constipation, diarrhea, nausea, vomiting, gas, heartburn, drowsiness, dizziness, or headache. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. Oxaprozin may increase your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if it becomes elevated. Contact your doctor immediately if you experience any serious side effects, such as severe or persistent headache, changes in vision or hearing, changes in mental/mood, unexplained stiff neck, signs of kidney problems, easy bruising/bleeding, or symptoms of heart failure. In rare cases, this medication may cause serious liver disease. Seek medical help if you experience symptoms such as persistent nausea/vomiting, loss of appetite, dark urine, severe stomach/abdominal pain, or yellowing of the eyes/skin. Although very rare, a serious allergic reaction to this drug is possible. Seek immediate medical help if you experience symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other unusual effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Oxaprozin, like other nonsteroidal anti-inflammatory drugs, may rarely increase the risk of a heart attack or stroke, especially if taken for a long time. This risk may be higher for older adults or those with heart disease, high blood pressure, or diabetes. It's important not to take this medication right before or after heart bypass surgery. Additionally, oxaprozin may rarely cause serious bleeding from the stomach or intestines, especially in older adults. If you experience severe abdominal pain, black stools, vomiting that looks like coffee grounds, chest pain, sudden vision changes, or weakness on one side of the body, seek medical help immediately. It's essential to discuss the risks and benefits of using oxaprozin with your doctor or pharmacist before starting treatment. Before taking oxaprozin, it's important to talk to your doctor if you have any allergies to medications like aspirin or other NSAIDs, as this product may contain ingredients that can cause allergic reactions. Also, be sure to discuss your medical history, especially if you have conditions like asthma, liver disease, stomach problems, heart disease, high blood pressure, or kidney problems. If you are using oxaprozin, it's essential to stay hydrated, especially if you are an older adult, have heart failure or kidney disease, or are taking certain medications. Be sure to drink plenty of fluids as directed by your doctor to prevent dehydration. It's important to be cautious when using this medication, as it can cause dizziness or drowsiness. Using alcohol or marijuana can increase these effects, so it's important to avoid driving or using machinery until you can do so safely. Additionally, daily use of alcohol and tobacco can increase the risk of stomach bleeding, so it's important to limit alcohol and stop smoking while using this medication. If you're using Oxaprozin, be aware that it can make you more sensitive to the sun. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. For older adults, there may be a greater risk of stomach/intestinal bleeding, kidney problems, heart attack, and stroke while using this medication, so it's important to discuss these risks with your doctor. If you are a woman of childbearing age, it's important to talk to your doctor about the benefits and risks of using this medication. It may harm an unborn baby, and if used during pregnancy, it's recommended to use the lowest effective dose for the shortest possible time. Additionally, it's unknown if this drug passes into breast milk, so be sure to consult your doctor before breastfeeding. When taking Oxaprozin, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Oxaprozin include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, lithium, methotrexate, and water pills, diuretics such as furosemide. This medication may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers and fever reducers that are similar to Oxaprozin and may increase your risk of side effects if taken together. However, if your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking the aspirin unless your doctor instructs you otherwise. It's also important to note that Oxaprozin may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are using this drug. Remember to always follow your doctor's instructions and consult with your pharmacist for more details. If you or someone you know has taken too much Oxaprozin and is experiencing severe symptoms like passing out or having trouble breathing, it's important to seek medical help immediately. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an Oxaprozin overdose may include severe stomach pain, vomiting that looks like coffee grounds, extreme drowsiness, loss of consciousness, and slowed or shallow breathing. It's important not to share Oxaprozin with others. Your doctor may also conduct lab or medical tests, such as blood pressure, complete blood count, or kidney/liver function tests while you are taking this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. In addition to taking Oxaprozin, your doctor may also recommend non-drug treatments for arthritis, such as weight loss, strengthening, and conditioning exercises, to help improve your flexibility, range of motion, and joint function. Be sure to consult your doctor for more information on these treatments. And as always, follow your doctor's recommendations for the best time to take this medication and the appropriate dosage for your specific condition. If you forget to take a dose of Oxaprozin, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take 2 doses at once to make up for the missed one. It's important to store Oxaprozin at room temperature, away from light and moisture. Avoid keeping it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to disposing of Oxaprozin, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed, and it's best to consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.